Hey folks, it's Dr. Mike, and we're back here again with another blog post. And this one looks at the 8 habits of highly successful medical exercise specialists. Now folks, I've been training medical exercise specialists since 1994. And over the years, we've run into some incredibly successful medical exercise specialists in that they've built strong practices, they've produced great outcomes with their clients, and also they've connected with the medical community. So let me give you these 8 successful habits of medical exercise professionals. The first one is define. They define who they are, what they do, how they do it, and who they do it to. Folks, you've got to define your role and scope of practice as a medical exercise professional, because if you don't, the physical therapist, the physician, the client doesn't know it. So it's up to you to make sure you define who you are, and this will take you a long way towards success. The second thing is they present. They're able to present their concepts with regard to managing clients utilizing simply exercise to physical therapists, to chiropractors, to physicians, and most importantly, they present it well to clients so clients will buy in and follow the exercise program they put together. The third one is they report. They report their successful outcomes, their findings with the assessments, the client's exercise program. They report that to the doctor, therapist, and chiropractor, as well as reporting it and sharing it with other medical exercise professionals. Number 4, they follow up. Now, I think this is one of the most important aspects of being a medical exercise professional that's successful is the idea of following up with doctors, therapists, and chiropractors with regard to your clients, their patients, sending those progress reports, following up on progress reports when there's a question, or following up when you have a question for the doctor, therapist, and or chiropractor regarding one of your clients. Next, assess. Our medical exercise professionals that are successful do a great job with assessing their clients. They're able to assess the client, determine the client's needs from a standpoint of their functional exercise or medical exercise training needs, and then they're able to take that information and develop it into an effective exercise program for the client so they can see progress with the client toward their functional outcome measures. Next, number 6, progress. They're able to progress the client. Once they assess the client and determine their needs, they're able to progress the client effectively to eventually reach the short-term and long-term goals they develop for the medical exercise training program. Number 7, they motivate. Folks, being able to motivate clients when they're having pain or they're having significant problems, you're going to see clients when they're at their worst some instances. They've gone through physical therapy, they've gone through chiropractic care. Yes, they're doing better, but in many instances, it takes a lot to keep them motivated and keep them moving through. As a medical exercise specialist, especially a highly successful one, you got to be able to motivate. And lastly, educate. This is one that I think is going to become more important for medical exercise professionals and our medical exercise specialists is the idea of educating. Folks, medical exercise training is still in its infancy. We've only been doing this now for 26 years. And you say, well, Dr. Mike, that's a long time. Folks, when you're actually trying to interact with the medical community, and we have professions that have been around since the dawn of time in the medical community, we're pretty much infants on the block. So one of the key things for our successful medical exercise specialists is the ability to educate doctors, therapists, and chiropractors with regard to your role, your scope of practice, where you fit in without getting out of your lane and bumping into the therapist or the chiropractor's lane. This becomes important. Also, educating the client with regard to lifestyle education, following through on their exercises, but most importantly, again, educating them with regard to where you fit into that overall medical management process, utilizing only exercise. So these are the 8 habits of highly successful medical exercise specialists. Again, we've seen these consistently with medical exercise specialists around the world that are successful. If you have more questions about these, please email me at drmike@postrehab.com or go over to our blog, or if you're on our blog now, look down below. We actually have an article you can read that goes into greater depth with all of these 8 habits of highly successful medical exercise professionals. Thanks for watching, and best wishes building your medical exercise training practice.